We are right at 1 o'clock. I'm going to go ahead and get started. Thank you, everyone. Welcome, and thank you for joining us today for the pre-application webinar for PAR 23066, Research on Community Level Interventions for Firearm-Related Violence, Injury, and Mortality Prevention. I'm Dara Blackman-Demner from the Office of Behavioral and Social Sciences Research. I'll be presenting today along with Anna Riley from our Center for Scientific Review. Next slide, please. We also have a number of program officers in attendance. They will come on screen at the end and will be available to answer your questions. Next slide, please. Just a couple of logistics. So all participants are in listen-only mode and will not be able to ask questions verbally or use the chat. So we ask that you place all of your questions in the Q&A feature, and we will answer them during the Q&A session at the end as time permits. And in addition, these slides, a recording of the webinar, as well as a frequently asked questions document will be available shortly on the OBSSR website. Next slide, please. So briefly, what we're going to go over today, I'm going to first talk about the background, objectives, and expectations for this program announcement, and then my colleague will talk about the peer review process. We'll briefly go over the timeline, and then we will have plenty of time for your questions. Next slide, please. Next slide. Okay. So the objectives for this program announcement is to add research projects or research sites to an existing research network that was funded last year, the Community Level Interventions for Firearm Violence Prevention, or CLIF-VP. All projects will be expected to develop and test prospective interventions that are at the community or organization level. And projects will be funded as cooperative agreements, phased cooperative agreements. I'll say more about this specific mechanism later. And they will join our 3 existing projects, as well as the coordinating center that is at the University of Michigan. Next slide, please. A little bit more about the structure of the network. So there is a steering committee that will provide overall governance and guide cross-project activities. And there's an expectation, if funded, that there would be at least 2 representatives from each research project, typically the academic PI and a community PI or key personnel, along with coordinating center and NIH representatives. The steering committee will meet once a month and will engage in a number of joint activities that include coordination of protocols when appropriate, data harmonization, manuscript dissemination, and things like that. Next slide, please. So just before I jump into some of the details, this information is in the funding announcement, but just to clarify what we mean by community. So we are defining for our purposes a specific group of people, often living in a defined geographic area, who share common culture, values, and norms, and who are arranged in a social structure according to relationships the community has developed over a period of time. So it may be a self-defined, or it may be defined by a particular catchment area. For this particular opportunity, we are not including virtual communities. And a community organization would be a non-federal, non-academic organization that provides a range of goods, services, support, or resources to members of one of these defined communities. Next slide, please. So I'm guessing if you are here today, I probably don't need to go over all of this with you, that you understand the public health impact of firearm-related injury and mortality. Some statistics here in terms of over the last, from 2019 to 2020, that the homicide rate increased to its highest recorded rate in over 25 years. I'm not going to read through all of these additional statistics, but to note that in 2020, firearms accounted for the highest proportion of all methods used for suicide, and firearm-related injuries became the leading cause of death for youth ages 1 to 19. The rationale for this network is that most preventive interventions remain focused on high-risk individuals or delivered in group settings. And there's really a critical need for community-level preventive interventions that engage partners in meaningful ways. And that's how we have structured the funding opportunity and the network. Next slide, please. So again, these are listed in the funding opportunity, but just a couple of ideas of potential questions that could be proposed in projects. So thinking about new or innovative violence intervention practices that really come from basic social and behavioral research. Thinking about type and dose of intervention components and how they're combined or sequenced to optimize effectiveness. Thinking about the role of unique contextual factors in either enhancing or inhibiting potential effects, thinking about various sources of adaptation within a range of community contexts, and thinking about the community organizational and contextual level barriers or facilitators to wide-scale adoption and sustainability. Next slide, please. So again, we are requiring that the intervention proposed is an intervention that modifies community level or community organization characteristics. So this could include things like physical or built environment, social environment, policies or practices, or norms and collective behaviors of residents. Next slide, please. Just to further sort of clarify what we mean by a community or community organizational intervention. So an intervention that is delivered in a community setting or uses community-based outreach, but really is still intervening at the individual level and is not targeting any community level determinants of health would not be considered responsive. In addition, an intervention that focuses exclusively on helping individuals cope with the impacts of violence and do not directly attempt to address the root causes. And finally, an intervention that might have some community-wide elements, but the intervention effects are only tested at the individual peer or family level. Next slide. Some additional requirements for the proposals that they need to be conducted in collaboration with appropriate community organizations, and that will be manifest in either key personnel, budget, joint development of the research and intervention plan. As mentioned, that there needs to be a prospective intervention and collecting data beyond individual self-report. And you'll note, and we can come to this in the Q&A, for people who are considering applying to NIMH, there's a link to additional priorities for research on violence and aggression. Next slide, please. So these are things that would be encouraged but not required in the proposals. Multi-sectoral collaborations, guided by a conceptual model that identifies hypothesized pathways between the intervention, the determinants, and violence-related injury and mortality. Again, there need to be appropriate measures and analytic methods to really be looking at these community and organizational level mechanisms. Ideally would have at least some preliminary data and would include assessment of relevant social determinants of health. Next slide, please. And this is a reminder of the criteria for non-responsive applications. So I'll say more in just a minute about the phased mechanism, but there's an expectation that there would be specific aims as well as a well-defined set of milestones for each phase. I already mentioned the virtual community and the prospective intervention, projects that don't include a plan for baseline data, projects that only use individual level data or are exclusively qualitative, although we certainly encourage multi-methods. Projects that do not have community partners as key personnel, and projects that propose to collect data outside of the US. And again, we strongly recommend that you reach out to one of the POs that's on the call today and listed in the funding opportunity before your submission. Next slide, please. Okay, just briefly, a little bit about the phased mechanism, as I know it may not be familiar to everyone. So these are projects that are funded for up to 5 years. Phase 1 or UG3 phase is a 1 to 2 year award. It is a milestone-driven study that should demonstrate sufficient feasibility, preparation, and capacity needed for the implementation of the study planned in phase 2. It could include scientific, operational, planning activities, as well as some tangible deliverables or preliminary findings. And phase 2 would be 3 or 4 years of support for the actual implementation and evaluation of the intervention that was developed in phase 1. And you'll note this is a clinical trial required funding opportunity. So the expectation is that all projects will be developing the foundation for implementing a clinical trial in phase 2. Next slide, please. Projects that meet the milestones will be considered and prioritized for transition. Please note that funding of the first phase does not guarantee support of the phase 2 award. And all funded projects may not transition to the UH3 phase. Transition will be determined by the availability of funds and the outcome of a programmatic evaluation at NIH. Next slide. Okay, I'm going to turn it over to Dr. Anna Riley from our Center for Scientific Review, who's going to talk about the peer review process.
Hi, thank you, Dara. The purpose here is to talk about the peer review process and how the application will be evaluated once they are submitted to NIH. Next slide, please. The purpose of peer review at NIH is to make sure that each application evaluated in a manner that is fair, independent, expert, and timely, and free from any inappropriate influences, so that the most promising research can be funded by NIH. Now, there are two levels of review. The first level of review is at the study section level, or the scientific panel level, which is we gather experienced scientists and clinicians with expertise in relevant disciplines or methodologies, or the population on the research. And that's the first level of review. The second level is by the IC Advisory Council, which is composed of both scientific and public representatives chosen for their expertise, interests, or activity and manners related to health and disease. The final decision in terms of funding is made by the IC directors in consultation with the program officers. Next slide, please. Now, the review process, you do not have to, for this particular PAR, you do not have to ask for a certain study section, because these applications will be reviewed in a special emphasis panel. And so you do not have to ask for that. The review will take place in June or July. It will take place in June. All applications will receive written critiques. Only those applications deemed to have the highest scientific merit or technical merit will be discussed and assigned overall impact score. So only those applications that are reviewed or discussed will receive an overall impact score. And you will receive that score in your summary statement. And the summary statement will be provided 30 days after the meeting completion. And the summary statement is the official record of the review process and results. It provides a summary of the key discussion points that were discussed at the study section that resulted in your final composite score, as well as comments and scores or assigned reviewers. Now, all applicants will receive a summary statement. It's just that those that were discussed will receive your overall impact score. Those that are not discussed will not receive an overall impact score. You will receive scores, although you will receive scores for the criteria, and I'll go over those in a minute. Next slide, please. After your application is submitted to NIH, we ask that you please try to submit this before the deadline date. If you submit before the deadline date, you have a chance to go back in and correct errors. If you submit on the deadline, it's almost impossible for you to go in and correct any errors. So basically, I would suggest that you submit before the deadline. Also, once your application is received by NIH, all applications are received and processed by the Division of Receipt and Referral. Now, the Division of Receipt and Referral will assess the application for completeness, and they assign it to the special emphasis panel that's being run by CSR. The job of the program officer is to assess the responsiveness of the application. And as Dara said, non-responsive applications are withdrawn from review consideration based on that non-responsiveness criteria that she just went over to explain. The review process is handled by the scientific review officer, and that's the SRO. The SRO will assemble a panel of expert reviewers to conduct the review and the technical and scientific merit of that application. Next slide, please. Now, what we generally do with reviewers, we explain to them about confidentiality rules when we first recruit them. That means that all review material and proceedings or review material presented is confidential. It's confidential in terms of reviewers and NIH staff. At the end of each meeting, reviewers are asked to destroy all review material. Now, reviewers should not discuss any review proceedings outside of the presence of the scientific review officer. Questions and concerns regarding review should always be referred to the scientific review officer. Applicants should never communicate with any member of the study section about an application. There's no statute of limitation on this. Confidentiality is life. Next slide, please. Also, we ask reviewers when we recruit them to look through the application to see if they have a review, they have a conflict of interest. And there are various types of conflicts of interest. These are some of the examples. Institutional conflict, they're at the same institution, regardless of whether they know anybody on the application or not, they're at the same institution, it's a conflict. If there's a family member, a close friend on the application, it's a conflict. If they are a collaborator with someone on the application, or person that's a key personnel on the application, that's a conflict. And if there's a long-standing scientific disagreement, that has to be a well-known, long-standing scientific disagreement within the field for that to be considered a conflict, but it is a conflict. If there's some type of personal bias with anyone that's named in the application, then that's also considered a conflict. And generally, the appearance of conflict is also considered a conflict. And what we mean by the appearance of conflict, that if a person was explaining a certain situation, would they question your impartiality? We can ask reviewers that. Then if you think they would question your impartiality, then that's also considered a conflict. Next slide, please. Now, how are these applications scored? Application receives they receive score for the 5 review criteria, which is significant, investigative, innovation, approach, and environment. But they also receive an overall impact score. And these scores are from 1 to 9. Reviewers will evaluate those 5 review criteria: significance, investigative, innovation, approach, and environment. They receive a score of 1 to 9. They also will evaluate, the main thing they are evaluating is the overall impact. And the overall impact is the likelihood that the project will sustain a powerful influence on the research field. Now, those 5 review criteria, they determine what the overall impact will be, along with some other criteria that do not receive scores, like human subjects, biohazard, or inclusion of gender, minority, and age groups. Next slide, please. Now, the 5 review criteria is significance. In general, significant means, does the project address an important problem or a critical barrier to progress in the field? And we also ask reviewers to evaluate the rigor, what we call the rigor of the prior research. And that means to evaluate the quality and the strength of the research is being cited in that application to support the proposed research. And if the aims of the projects are achieved, will scientific knowledge, technical capability, or clinical practice be improved? Also, how will successful completion of the aims change concept, methodologies, interventions that drive the field? That's significance. The investigator, when they evaluate the investigator, we evaluate the collaborators and research. Are they well suited for that project? In other words, do they have expertise to carry through that project? If they're early stage investigators, basically reviewers would evaluate whether they have the experience or the training to conduct that particular project. Well, if the project is collaborative, a multiple PI investigative project, do they complement each other in terms of they integrate expertise on the team? And also in terms of the leadership, how do they organize and govern organizational structure appropriate for that project? Because it was MPI, there may be a multiple site project. So are they good at organizational structure in terms of that project? Innovation. Does the application challenge or seek to shift current research or clinical practice by utilizing novel, new concept, approach, and methodologies or interventions? Are the concepts or the approaches or interventions novel and just for the field, or will they be novel beyond the field in the broad sense? Is the refinement or improvement a new application of technical concept, approach, and methodologies, or what are intervention proposed in that application? So basically, that's innovation. Is it something new? Is it utilizing new, or will it provide something new for the field? Approach. Are the overall strategy and methodology and analysis well reasoned to accomplish specific aims in the project? Do they address any weaknesses in the prior research in the field? Have the investigator presented strategies to ensure that there's a robust, unbiased approach or that's being proposed? Or are they looking at alternative strategies that may address a certain potential problem in that particular research? So all this, the final thing that we ask them to look at is that, have they presented adequate plans to address relevant biological variables such as sex? And that includes both animal and human studies. And the environment, will the scientific environment work, help contribute to the probability of success? So is the institution providing support with equipment, space, etc.? And will they benefit from that scientific environment in terms of collaborative agreements and so forth? So that's environment in general. These are the review criteria in general. Next slide, please. So how do they relate to the PAR for this particular PAR? In terms of significant, is it a clear, appropriate theoretical basis being for both proposed intervention that's being proposed, or for the process for developing and adapting, tailoring the intervention to the community that's being proposed? So basically, is there a clear theoretical basis for the intervention that's being proposed, or for the processes for developing and tailoring that intervention to the community that's being proposed in that application? Does the intervention have potential to be sustained after the project is over, or can it be scalable to other settings? In terms of investigator, basically for this particular PA, do they have relevant experience in testing and implementing community interventions and working with that community that's being proposed in that particular application? And do the investigator have experience with conducting multi-site or multi-project studies in terms of collaborating with project sites in terms of protocols and data harmonization? Do they have, are the responsibilities clear in terms of how they define their responsibility as collaborators? And are there appropriate stakeholders involved in the research team or on the project? That's the investigators. In terms of approach for this particular PA, how well does the research project clearly define identifiable strategies for the UG phase of the project? That's the planning and development phase of the project. How well does the project conceptual framework clearly inform the analysis of data and potential pathways for the UH3 phase? And that's basically is that conceptual framework that clearly defines how the data and potential pathway will lead to the evaluating in the implementation stage of the project. How successful the UH3 phase and proposes strategy and approaches have a clear pathways from the U3 data. So the U3 data, the planning and development stage, the strategy should lead to that evaluating implementation stage of that project. And also, are the proposed timelines well-defined? Are they feasible in terms of the timeline? Does the application include an adequate plan for working with the coordinating center? Are they considering the role to provide administrative coordination, data management, or analytic and consultation, and also stakeholder engagement in terms of the coordinating center? So one of the things I would suggest that when you're reading the PA, make sure you read section 5. In section 5 of the PA, it tells you in terms of those review criteria, what is specific for the FOA, for this particular FOA. And these things are listed in section 5 of the PA. Next slide, please. And these were the additional review criteria. I was saying that affect your overall impact score, which is human subject, inclusion of sex, gender, race, ethnicity, and whether they're dealing with appropriate vertebrate animals or they managing biohazards. Next slide, please. And the contact person here at CSR is Elia Ordenberg. She will be in charge of making sure that this review panel is set up for this review for this particular PAR. And thank you. These are some websites you want to go and find about the peer review process. These you can go to any of these websites. It'll give you the overall review of how CSR conduct their scientific review panel and the submission process. Next slide, please. And that's it. Dara.
Thank you so much, Anna. Very helpful. Okay, I'm just going to go over a couple more logistics and then we will open it up for questions. So timeline, as a reminder, the application due date is March 17th. If you would like to submit a letter of intent, that's due 1 month prior. It's not required. As mentioned, the peer review meeting will be in June. These will go to August council review with start dates in September. Next slide, please. As I mentioned, these are the contacts for all of the various institute centers and offices that have signed on. Their contact information is listed in the funding opportunity announcement, and we strongly encourage you to reach out to them prior. If you're not sure which institute would be the best fit, you can contact me and I will help connect you to the correct person. And final slide, I believe. Yes. Okay, so I think, is there one more slide that just has, yes, so this has our contact information. All of this will be posted on the OBSSR website, the slides, the recording, as well as some frequently asked questions. So maybe now we can stop sharing and we will open it up for questions. I'm going to invite my colleagues to turn on their cameras and be available for questions. Wonderful. Okay. Thank you. So the first question is a good one, I think. Are there limitations on whether more than one project will be funded in the same city? I will go ahead and take that. And I will say, you know, we certainly don't have any hard and fast rules about that. You know, each application will be evaluated on the scientific merit as it goes through peer review. But you know, it is certainly the case that that may be one of the factors that's considered as we're thinking about putting together a network that's going to have as broad of a reach as possible. So it's not to say we couldn't, you know, if they were very different projects in the same city and we felt were both important in capturing or addressing, you know, different aspects of violence prevention, then, you know, that could be an option. But certainly geographic diversity is one of many factors that would be considered in ultimate funding decisions. Okay. So there's a question about the budget parameters. I'm not exactly sure if that's asking about the budget limit. All of that information should be in the program announcement. Perhaps the person who asked this question could type in a little bit more detail if there's a specific question about budget so we can make sure to answer. Yes, someone has asked where the current funded projects. So that information is available on our website. We currently have a project in Chicago, in Washington, D.C., and in the state of Mississippi. Okay, Stephen, did you want to answer?
Sorry about that. I think I pushed something that I didn't actually know what it did. But yeah, just to clarify, in the FOA, it does say that application budgets are limited to $500K per year in direct costs in the UG3, and then $1 million per year in direct costs in the UH3.
Perfect. Thank you. If there are additional budget questions, please put them in the chat and we'll, okay. Okay, so there's a question about are policy changes that impact organizational practices considered to be an aspect of a multi-level intervention? Somebody want to take that one?
I can take a stab.
Just trying to give others a chance to speak.
I think it depends on what policy changes are being referred to. So if they're happening in the background, like federal policies, state laws, probably not. But if they're policy changes that an organization is implementing prospectively as part of the project, then it could certainly be considered part of a multi-level intervention.
Great, thank you. Other thoughts about that?
Yeah, and I guess I would add that if the kind of theoretical framework is that those policy changes would somehow have an impact on the community that you're studying, since this is community level violence prevention. So there should be correspondence between the policy that you're evaluating, hoping to intervene in, and the community that you're hoping to benefit from this intervention.
Great, thank you. So there's a question about opportunities to resubmit, and this is a one-time opportunity, so there will not be formal resubmission to this opportunity. But certainly that's something you could talk to program officer about, and there may be other, future opportunities that might be similar that could apply to. Okay, there's a question about budget estimates. Our budget estimates for each year of the UH3 required at submission of the UG3. Yes. And that is outlined in the funding opportunity as well in terms of the requirements for the budget submission. Do you encourage multi-city, multi-site studies? Somebody want to take that one?
Well, again, I think that the onus is on the applicant to make the case for why a multi-city, multi-site study would help to achieve the aims of this funding opportunity. You certainly can propose that. I would encourage you to talk with the program officer at the institute for which you think this study might be most relevant. But if that is a part of your set of proposed activities and you have the wherewithal to carry out your study as you're proposing it, and you are arguing and making a strong case for the fact that this multi-site study will, for example, allow you to have access to populations or communities, then talk to the program officer to look at program relevance, and the onus would be on you to make sure that you made the case for why this would be an important opportunity.
Great, thank you. And I see my colleague Melissa has her hand raised. Did you want to jump in here?
I just wanted to jump in
Sure.
and add, in addition to the comments we just heard, the response is that you would be responsible also for making the case that this would be feasible. So providing evidence for its feasibility. And so that would need to be taken into account. And that would involve all sorts of aspects of your project. From the investigative team working together for the community engagement kind of steps that have already been taken that can demonstrate this possibility, and so on. Thank you.
Great, thank you so much. Okay, I don't see any other questions. I'm sure there are some more out there, so please keep them coming. Okay. Do you have a link to expenses that are not allowed? Things like handgun safes, other more robust firearm safe storage items. I'm going to maybe see if Stephen wants to tackle this, because I'm guessing you have a lot of this in some of your grants and could potentially answer that. Sorry, I don't put you on the spot. But...
Oh, yeah, no, that's okay. I wish that I did have more to say about that specifically. sometimes, I think that we see that the handgun, the trigger locks are included. I think when you start talking about safes, the question is going to be sort of sustainability and scalability. To what degree is this only feasible because there's research dollars to, buy those safe gun storage options? And that would probably impact the significance. So I think you would just sort of want to think through, how that's going to be funded and sort of how it would be sustained after the study's over.
Great point. So I guess there's no, specific yes or no, but thinking about it in the broader context of the study. And it looks like in the chat, there's some information to the link just in general about funding restrictions. So thank you, Melissa, for that. Other questions? While we're waiting to see if any more come in, I'm wondering if any of my colleagues want to have any thoughts or comments that would be helpful, just given what we know about, applicants or people that applied last year and some of the common questions that came up or some of the common challenges or issues that came up during the submission review that might be helpful for folks to know about. Questions about kind of defining community level interventions and that sort of thing. If anybody has any guidance they'd like to share, I'm sure it would be appreciated. Valerie, yes, please.
Well, the only thing that I would like to say is just please, please, please read the funding opportunity announcement. Certainly understanding what we mean by the community and your commitment to engaging, a true engagement of the community is really important. So read all of the guidance on what we mean by community, what's not considered by community. And again, if you have questions, feel free to reach out to your program officers to answer any nuanced questions. But most of what we will be looking for is laid out fairly well in the program announcement. So please do take some time and read it. I know March 17th will be here before you know it. Time goes by really quickly, but it will be, really in your best interest to make sure that you know what the initiative is about, what our intent is overall, and the kinds of things that are really high priorities for this NIH-wide initiative.
Thank you so much. Another question did come in about reach. So is there a specific reach in terms of the number of people impacted that we are expecting? I mean, I think for this one, I would just say, as as is often the response, I don't think, again, we have kind of an a priori idea. It really is going to depend on how community is defined and, how the intervention is structured and what is a realistic expectation in terms of reach. Certainly the idea is that, I think the vision of the network as a whole is that there could be, some best practices and some models and things developed that could be, potentially used in other settings, but there's no kind of a priori number of people that we're expecting to reach. Okay, great. It looks like someone did post the link in the chat. So thank you for that. That has information about the current awards. If we have ARPA funding for service delivery, not research, with some community violence partners, are our partners and our institutions still eligible? Anybody want to address that one?
I would say yes. The main eligibility requirements are in the US. Is that right, Tara?
Correct. Mhm.
And that you wouldn't, the only restriction would be that you wouldn't get funded for something you're already funded to do.
Right. Right, so just making that clear in the application.
You may want to check whether there are any restrictions from ARPA's end, but not from our end.
Good point.
Yeah, especially as it relates to data sharing and things of that nature. So that will be really important since these sites will be part of a network and we would be anticipating sharing and harmonization of data.
And since you mentioned that, Valerie, I'll just piggyback on that in terms of your point earlier about reading the funding opportunity carefully. So, because this is a network, there are expectations around data harmonization and data sharing, and all of these proposals will also be coming in after the new NIH data sharing policy is in place. So, there's a lot, a lot of information that will be important to think about in that space as well. That should be all laid out in the PAR. Other questions? Okay. I'll give it another minute, see if any other questions come in, and if not, I'll just, wrap us up. And again, I will say that everything, this recording, the slides, as well as a frequently asked questions document will be available on the OVSSR website. Will take us some time to get it up, but we will do it as quickly as we can. Again, please, we encourage you to reach out either to me or to one of the program officers from the various institutes that you think might be the best fit, and reach out, sooner rather than later, so we can help you figure out, which IC might be the best fit for your potential project. And again, I don't see any other questions coming in, so I will wrap us up and say thank you again for attending, and we look forward to hopefully receiving applications from some of you. Thank you.